This is Edward Harshman giving the lecture in July 2013, Obamacare Exposed and Disproved. The Obamacare law, PPACA, is about 400 pages of law itself. The regulations deriving from that law create enough pages to make a stack of paper about 8 feet high. I admit I have not read through everything about it. I have to infer that it is too complicated for anyone to understand thoroughly. The insurance mandate. The government is now mandating us, ordering us to buy health insurance. In the past, when the government recommended something, there was usually a surplus: milk, grain, beef, whatever. So even a recommendation from the government should make us suspicious that they are trying to find a market for some surplus material. The government has increased the magnitude of the decree. Not, we hope you do, you have to do it. This demand that you must purchase something is nowhere in the Constitution. I happen to disagree with many of the Supreme Court justices who say this is a reasonable thing to do. It is represented as a tax, but the bill originated in the Senate, and only the House of Representatives can originate a revenue-raising bill. So there are certain people on the Supreme Court that need to go back to law school. Insurance is unfair in many ways. Buying health insurance is often a reasonable thing to do. What is the risk of something really dreadful going wrong? Buy insurance to help protect yourself. Often it is not. Who makes the decision? We, as individual people. Nobody tells us that this is the right thing for us. They could say, you do it, or we're going to find you or put you in jail, and then we will say, government repression. But they're never going to say, this is the right thing for you. Because if it's the right thing for us, we've already done it. Hospitals happen to like Obamacare because, and I'll get into it later, they are handsomely paid by Obamacare. They get more money. Doctors and nurses like getting paid also, but the benefit to them is much less. Now let's take a look at insurance and the mindset of the liberals. A liberal would say, if I could afford insurance, I would buy it. If I could not afford insurance, I would want subsidies so I could buy insurance. And if I, the liberal, am rich enough to help poorer people buy insurance, I would be willing to give some money to help them. See, this is part of the liberal mindset. That's how liberals think. They guess how how we feel, and they rubber stamp us with their guesses or whatever is easiest for them to think we believe. What they think we believe or what they think we should believe. And if we say, no, we disagree, they say we have the problem because we're not allowed to think differently from the way they expect us to. This is an important part of liberal philosophy. Imputed beliefs. Liberals impute their beliefs onto the rest of us. And another example is they say that the intent to solve a problem is admirable. We want to make sure that everyone can get health care. That's the intent. That's what they say. But the results are not important. Here's the intent, so let's go do some la-di-da, wave the magic wand all over the House of Representatives and the Senate, and hey, presto, we've done something. Doesn't make any difference if the something is worthless or if the something is destructive. We're trying to solve a problem, we did it. Hooray for us. Oops. See, many well-meaning but misguided liberals don't look beyond the stated intent. If the plan is attacked by people like us, we are evil because we are disagreeing with the intent. That's the way they think. They're wrong, but you have to understand this. Now, I accidentally made an important discovery about imputed beliefs. I sent a short commentary to the Medical Sentinel, and it was published in the winter 2004. A short piece about how being exposed to imputed beliefs in early childhood may be a contributing factor to autism. There are some issues about mercury, which are credible. There are some issues about other nutritional imbalances, also very credible, but no one has paid any attention to a behavioral component. So, what do you think happened in response to that publication? Campers, any ideas? What happened? I'll give you a hint. I'm not in jail. All right, I will tell you. I got some personal attacks by email. You know, how dare you? You need to go back to medical school. You don't know this stuff. How dare you say this? Blah, blah, blah. All right? But nobody said I was wrong with a clear refutation. Nobody said, no, that doctor is out of his mind. That is not what happens when people are brought up with imputed beliefs impressed on them. Here is what happens instead. Nothing. Complete silence. The study and analysis of what happens when small children are brought up with imputed beliefs thrust on them is dramatically absent from modern psychology. It just isn't there. See? Here is Billy. He's 4 years old. I know exactly what he wants, so I'm going to get it for him and I'm going to do it for him. I'm not even going to ask him because I know. Now, if somebody tried talking like that to you, you'd say, no, I don't agree, that's not what I want. You'd speak up. Or if you weren't allowed to, you'd say, that guy is a jerk. Right? But a small child who doesn't know any better is going to learn wrong. And this theory of imputed beliefs is very important when analyzing liberal thought. Please learn it. Let's take a look at the Internal Revenue Service, back to Obamacare. The Internal Revenue Service is under attack because of misusing its authority. It's got some problems enforcing income tax. It's got some problems with angry Tea Party people. Do you think it can also enforce health insurance law? I don't. Enforcement of the mandate requires tampering with religious beliefs. Christian Scientists, they have to buy insurance whether they want to or not. Who will pay for birth control, abortions, major care as for severe illnesses? Jehovah's Witnesses don't accept transfusions. Do they have to pay for them anyway? They probably do. So after a while, the Internal Revenue Service is going to have a good-sized data bank on our religious affiliations. Now, Hitler did that. I don't like him. Same precedent. Watch it. The regulations are rather a mess. HIPAA, which stands for, well, you can read it, includes requiring a specially worded, quote, privacy statement, unquote, to be given to all patients. The privacy statement has a loophole that permits government snoops access to the records without consent of the patients and without consent of the doctor. It says some legalese about how, under special circumstances, and we're not going to tell you what they are, government people, we're not going to tell you what they are, will have access to your records, and we're not going to tell you when. There's a lot of we're not going to tell you that should be in there, and it isn't. Without HIPAA, if the medical facility is HIPAA exempt, then the state privacy laws are in full effect. Somebody snoops on your medical records and there is no HIPAA involved, you have recourse. You could go to court, you can sue. Hey, that's an invasion of privacy, and you will win. HIPAA gives the government snoop rights. Now, also about guns. I know about Maine, I don't know about other states, but there are forms that the health department gives out for well-child examinations, and it includes inquiries about firearms in the house. Do you have firearms? If so, are they locked up so small children cannot misuse them? Hey, guess what? The medical records say where the firearms are. Now the gun grabbers can run around stealing records and then going after the guns. So that's why I'm very careful. I will not write down any gun ownership in my medical records. A HIPAA medical office has to have a compliance officer to learn the rules and make sure that they are followed. The officer has to be paid. The expense of following the rules also has to be paid. That gets expensive. It drives the cost of health up because the government is telling us to do something we don't want to do, and we have to do it anyway, and we have to pay for it. So unless that mess of HIPAA and compliance officer and its own big stack of paperwork is erased, even before touching Obamacare, I'm not going to believe they're trying to cut costs. Now let's get back to Obamacare, the PPACA. You can read about what that stands for. Nancy Pelosi, who was the House Speaker, said, first pass it, then we see what's in it. She could have said, first we defeat it, then we see what's in it. So if she doesn't know what's in it and she says, let's pass it, we don't have to believe in anything she says, right? The Pelosi pass first, ask questions later is not defensible. When I was a third-year medical student, I was in the operating room, and nobody said, let's cut the patient open and then learn anatomy. So, and Nancy Pelosi and the rest of her thugs and ruffians, I don't think they've ever been in the operating room. So what do they know about health care? The intent of Obamacare is stated as keeping the out-of-pocket cost to patients as low as possible. So whatever the insurance hoop-de-doo may be, when you go to the doctor, you should pay as little money out of your own pocket at the time as possible. Maybe there's insurance, maybe not. The cost to you is kept low. But there is no intent to keep the true cost as low as possible. Otherwise, the FDA would have been severely weakened. The FDA is responsible for supposedly keeping our drugs safe, but what it actually does is it interferes with telling the truth about certain drugs that is beneficial, good uses for them, but they have not been formally tested, or about nutritional supplements that are inexpensive and safe and legal, but you're not allowed to say anything about them. Let's take a look at education. To reduce healthcare costs, we should teach our children how to take care of themselves and minimize the need to get medical attention and surgical repairs. In school, people learn English, math, literature, history, science. Why not how to take care of yourself? That really needs to be in the curriculum. Also, anticipate mental health issues when there are problems with bad marriages, domestic violence, long-term mental health treatment because of being caught in some dreadful situation with relationships. How do you prevent that? You teach the children how to assess a future husband and a future wife. You don't wait and later on try to undo the damage at great expense, and you have some very heartbreaking stories thrown in on top of it. It's appropriate to teach how the heart works, what a stethoscope does, how to tell a harmless headache, how to eat right, and various other things. There is proof already that patients can take care of themselves even if the treatment is complicated. Who can give me an example of proof that patients can take care of themselves? A Band-Aid? That's right. That's one possibility. And brushing teeth instead of having the dentist send someone around to brush them is another. But there was a time when something was available by prescription only, and it was recently made non-prescription. You don't need a prescription for it anymore. And there was not a whole mess of misuse. Who can tell me what it is? Insulin. Insulin and insulin syringes are not prescription items. So diabetics who cannot afford to go to the doctor all the time to get refills can take care of themselves much more cheaply. And we don't have an epidemic of insulin shock or of diabetic coma or of other things. It doesn't happen. People can take care of themselves, and here is proof. Don't let anyone tell you, but the people cannot be trusted to do it. People can. An overdose of insulin can be fatal. That does not happen. Hospitals and other big entities get big money under Obamacare from Medicare and Medicaid for each hospital admission. The hospital gets the block grant, the lump sum, and the hospital apportions the money to the administrators, doctors, nurses, and support staff. Now guess who's going to get most of that money? I don't think it's going to be the nurses. Probably not the doctors either. It's going to be the administrators. They love Obamacare. To them, it's a get-rich-quick scheme. To me, it's a find another career scheme. See? Now there is interest in non-hospital facilities in which the doctors are the owners and the managers, and they get the Obamacare payments. They're not the hospitals. And of course, the hospitals are going to say, we don't like this. Let's bring on some more regulation. The idea being that the more regulation, the better things work. We all know that's not right. Electronic prescribing is required by Obamacare. Otherwise, Medicare and Medicaid will impose pay cuts to the doctors. Now, I looked over all of this from my own practice, and I said to myself, I'll take the pay cut. I'm not going to spend a fortune on electronic prescriptions. The acronym HIT is common in healthcare for Health Information Technology. HIT. Everyone in healthcare knows what that means. So, I call our president the Obama the Hitman. He's pushing HIT, right? NGO, non-government organizations, or whatever you want to call it. IPAB. Its members are appointed by the president without legislative confirmation, the way cabinet members need Senate confirmation, not the Independent Payment Advisory Board. So they can reduce Medicare and Medicaid payments arbitrarily without any appeal. This is a very dangerous situation. So that's why they say death panel. They could say, we're not going to pay for this or that procedure if the patient is over age 65 or has Medicare or this or that. No appeal. So who's going to be on that board? I don't think it's going to be Dr. Ron Paul or Florence Nightingale, Mother Teresa. And Jesus, he's kind of told us to, well, more likely it's going to be someone like Nancy Pelosi who got us into this mess, Ben Bernanke with the funny money at the Federal Reserve, Bernie Madoff, who has managed money extremely well as a Ponzi scheme operator, or maybe someone from Africa like Idi Amin, Obama the hitman himself. Who's going to be on that board? Another organization with authority and no accountability is the PQRS. You can read what that stands for. So this is what they are planning to do. They can simply cut down the payments and then we work for minimum wage. Here's another non-government organization with more power than it should have. The AMA is an example of a non-government organization, and it owns the copyright on the procedure codes, the 5-digit codes that a doctor has to put on the insurance form and send out to Medicare, Medicaid in order to get the claim paid. The procedure codes in use by the AMA were the subject of an antitrust lawsuit by the good guys, the American Association of Physicians and Surgeons. And I'm a member, and they have done some very good work. This lawsuit was dropped a few years ago when the decision was apparently made to abandon those codes and use different codes instead, the International Classification of Diseases version 10, ICD-10. And last I heard, there was some foot dragging about not changing over from the AMA codes to the public domain codes. Oops. When the Federation of State Medical Boards makes recommendations, and the state medical boards follow them blindly, the FSMB acquires power without any public oversight at all. The state medical boards generally belong to the Federation of State Medical Boards, which is a non-governmental organization. It is supported by the medical boards and is accountable to no one. PPACA, Obamacare, does not interfere. In fact, it explicitly strengthens other non-government organizations. They're trying to take authority away from us and away from elected representatives so they can say, we couldn't control this, we could not control this mess. Oh yes you could. You didn't have to give the authority away in the first place. They allegedly provide a high standard for doctors in their respective specialties, but they are not under any control by the public or by the government. Nevertheless, PPACA gives the American Board of Medical Specialties authority. Here's how. Many doctors are board certified. The specialty board has said not only are you good enough for a license, but also you're good enough to get a certificate saying you are especially competent. That's what it means to be board certified. The board certifies you. Recently, they said, no, we're not going to give you a lifetime certification. The certificate's going to expire in 10 years, except for obstetrics and gynecology, where it's 6. So you have to go get recertified. And PPACA gives the American Board of Medical Specialties the authority to do this. Now, who should have that? It should be the state medical boards or the state or us, the voters. It's not the federal government. This has nothing to do with insurance or helping the poor. It has to do with helping the medical boards. And what are the criteria by which a doctor gets certified or recertified? Specialty boards sometimes don't let doctors know what is being tested, so they wind up studying the wrong material. I fell into that trap myself. They say, study it, we're not going to tell you what's going to be on the test. We're not even going to tell you what kind of what category of material to study to be on the test. You're on your own. This also means that the patients don't know exactly what it means to be board certified. So the say-so of the board, you're good enough for us, oh what? It's like somebody teaching astronomy. The correct answer is the world is flat, but we're not going to tell you. Take the test. You failed. No, no good. Another thing is that they often use norm scoring. Who knows what norm scoring is? Well, if you take a test and there are 100 questions on it, and you get 70 of them right, you got 70%, you get 95 of them right, you get 95%. That's the raw score. That has nothing to do with what the person next to you gets. So far so good, that's the direct raw score. Everyone understand that? Okay. Now, if a score is normed, then they will take the original score, the raw score, look at everyone else's score, and then figure out how you rank relative to everyone else who took the test at the same time. That is a normed score. So perhaps you did better than 95% of the other people who took it. Perhaps you did really badly. You did better than 4% of the other people who took it. Perhaps you got the worst score in the entire bunch. That's the normed score. And for some boards, the scores are normed, so the minimum pass depends on how well everyone does. The highest 50% pass and the others fail. The highest 80% pass, the others fail, and so on. The inference of this is that the board cannot determine an absolute level of competency that has nothing to do with how well the other people do on the test. If you pass or if you fail, that has to do with how everyone else does. Let's take a look at PPACA and fraud. In general, the more elaborate the government scheme, the accounting systems, whatever, the easier it is to commit fraud. So PPACA fraud is theoretically very easy because it's so complicated that no one understands it. How is anybody going to find fraud if nobody understands how to do an audit? One major example of fraud, and this is a very easy one to understand, is disability applications. It is possible for somebody who might call a welfare rat to tell the Social Security Disability Office, oh, I'm disabled. I hurt my back so much I can't drive. Oh, I cannot get to work. I got to get a claim. I got to get disability. Right? Now, the same person goes to the driver license bureau and says, hey, I'm walking all right. I can drive. Let me have a driver license. See? No cross-checking is permitted. And I checked that out in the state government and know it's a federal regulation. The federal government will not allow the cross-check. Now, one would think that in 4,000 pages of PPACA, there might be a paragraph closing that loophole, saying if you want a driver license, you have to sign a release with the disability office. No, not there. Looked for it, didn't find it. So it would be easy to insert. They must be looking for the welfare rat vote. Okay, so my opinion of Obamacare, I can't tell you. I can't use profanity, so I'm stuck. All right? And you can count the good things on Obamacare with the thumbs of one hand